So the question is, what is the safest antidepressants to use in pregnancy? We have different types of antidepressants, which include the SSRIs, such as Citalopram, Fluoxetine, Sertraline, paroxetine, and then you have the newer antidepressants such as Mirtazepine. Then you have Venlafaxine and the older generation antidepressants, as well as tricyclics, which include Amitriptyline, which are known to help with pain, anxiety, migraines, as well as depression. But which of these are the safest to use? We do not usually recommend antidepressants for pregnant women, but for some who need to be on the medication, the risk of taking the antidepressant outweigh the risk of not treating the depression. For instance, a mother can stop caring for herself and the baby when born, and this can be due to postnatal depression. It is also thought that untreated depression can lead to risk of preterm birth and low birth weight. Also, children born to mothers with untreated depression have a higher risk of behavioral problems and depression later on in life, and this is due to high levels of cortisol. Cortisol is a stress hormone that works on certain parts of your brain to control your mood and other systems in your body, but if too high, this can lead to symptoms of anxiety and depression. The main concern is what side effects and risks can antidepressants have on the baby, and in most cases, a lot of mothers would rather stop the drug than take the risk at the expense of their own mental health. Antidepressants can cross the placenta into the amniotic fluid and affect the baby. So some of these side effects and risks include birth defects, such as abnormality of the baby's skull. So you have a condition called craniosynostosis, which is a birth defect in which the baby's skull join too early together. You also have abnormality of the wall of the abdomen. In some cases, you might see a bit of the intestines outside of the baby's body. There is also the risk of heart defects, and paroxetine, for instance, has been linked to heart defects in smaller studies, though this has not been proven in larger studies. There is thought to be an increased risk of miscarriage in the first trimester and preterm birth. However, there is no strong evidence that antidepressants can cause miscarriage. Also, there is a risk of autism. You can check out my video on the causes of autism, where I discuss the association between antidepressants and the risk of autism. However, the risk is thought to be so small that it's not significant reason to stop taking antidepressants, and in actual fact, it's found that there's actually an association between untreated severe depression and autism. Taking antidepressants in pregnancy can cause withdrawal symptoms in the baby, and 1 in 3 babies might experience symptoms such as agitation, poor feeding, being jittery, and low blood sugar, but these symptoms usually resolve within 2 weeks. However, with a drug like amitriptyline, your baby might get more severe symptoms such as fast heart rate, seizures, and irritability. The greatest risk of antidepressants is actually a condition that's so rare, however it is something to be considered, and it's called persistent pulmonary hypertension of the newborn. This is when the blood vessels of the lungs are not open fully, and as a result, oxygen cannot get to brain and other organs. Most doctors will tell you that a lot of antidepressants are safe in pregnancy. However, you might find that some antidepressants are safer than others. The risks that I mentioned are all very low. So if you look at the general population, there is a 1 to 3% of having birth defects anyway without being on medication. So some antidepressants might increase the risk by, let's say, 1%, while you might find that other antidepressants might increase the risk by 2 to 3 times that of the general population. So I'm going to give you 2 scenarios or dilemmas most women face. The first scenario is women who might have been on antidepressants before falling pregnant, and now that they're pregnant, they want to know whether to stop, to continue, or to switch to another antidepressant. It is generally advised that due to the risk of relapse, if you're already on an antidepressant, it is better to stay on it rather than switching just because of the possible risk to your baby. As I mentioned, the side effects or risks are quite rare, but if your depression is mild or you do want to stop, then you can consider non-drug options such as counseling or talking therapy, support groups, outdoor activities like exercise, and other lifestyle changes. If you are on a high dose of the drug and you do want to stop, or you've been using it for a few years and you feel better now, then with the help of a doctor, you have to try weaning yourself off the medication, because stopping abruptly can lead to withdrawal symptoms such as rebound depression, and this can last from weeks to months. If, however, you're not happy with the safety profile of the medication, or it's not working for you, and you do want to switch to what's considered to be safer, then bear in mind that you still have to be weaned off or cross-tapering of the medication, which again can take weeks, and there is a risk of relapse during this period. Now, the second scenario is when women who are already pregnant then have depression, and they do need to be on medication. Now the question is, which antidepressant can I take that are safe and effective at the same time? So if you're pregnant, maybe 8 weeks pregnant, perhaps you're moderate or severely depressed, and maybe you have negative thoughts of suicide or self-harm, you've tried all the different options like self-help, talking therapy, and lifestyle changes, or maybe you do not feel these options are suitable for you, perhaps you've tried them in the past and they haven't worked, or your doctor might have done an assessment and feels you need to go on medication. What is classed as safe medication is based on studies and data taken on pregnant women, as you cannot do trials and experiments on pregnant women. And you have to remember, what might affect one woman in pregnancy might not affect the other woman, and vice versa. So you might have the newer antidepressants like Mirtazepine that might be safe to take in pregnancy, but due to lack of sufficient data on larger numbers, it's difficult to come to the conclusion that Mirtazepine is safe to take in pregnancy. So Citalopram, Escitalopram, and Sertraline are the drugs recommended in pregnancy, but Sertraline is considered as the first drug of choice, as it has the best safety data and is not associated with any heart or birth defects. Also know that what you consider the safest antidepressant is not necessarily what might be the best antidepressant for you, as you have to take into account your medical and drug history, previous experience of the medication, possible interaction with other medications, as well as the type of depression you might be going through and any other coexisting mental health problems. So in terms of the safest antidepressant, the first choice is Sertraline. Other choices you can take include Citalopram and Escitalopram. Ideally, you want to avoid medications like Fluoxetine, Venlafaxine, and Fluoxetine, as these are thought to cause, birth or heart defects. So if you like this video, please feel free to subscribe to my channel, and you can check out my other videos where I discuss mental health, antidepressants, and depression.